One thing that I'm going to say in our practice, I think we were very successful in getting the majority, if not all of our patients onto care plans. And I got to the point where I was so adamant and so confident and certain in what we were delivering, which was a corrective care program. I was unwilling to accept people as they went, pay as they go. That was not an option in our office. And I don't care what the college says or what your board says or what trouble you're going to get in. That's not what we were delivering. I was not delivering pay-as-you-go, symptom-based care. So we just decided we have a corrective care plan. We're very good at it. We know what we're doing. We get great results. If you want it, here it is. If you don't want it, there's lots of other chiropractors in our town that I'd be happy to refer you to if that's not what you want. But everybody was introduced to it and given a specific care plan based on their condition. So we were that confident in what we were delivering. So I'm going to get into this and talk you guys through this, that hopefully you leave this call today with some certainty that you can say, okay, we're going to start delivering care plans on a higher level and get a much higher percentage of closing for people that go on care plans. So it's not really just helping patients get out of pain. It's helping patients choose health and life, not just pain relief. And here's some key points we're going to go through today. And that is really understand that the close of the care plan is made long before the report of findings. So if you're waiting to put the care plan on the table for that person to say yes and accept it, it's way too late. So it starts right at the beginning. So that's the first thing. We want to develop unwavering certainty in recommending a corrective care program because many of us don't have that certainty. We're going to talk about and learn how to educate and inspire rather than try to persuade or convince. And we're going to build a patient journey where the care plan becomes the obvious next step. There's no question that this is what the patient decides. And that's ideally what we're doing is we're giving them the opportunity to decide to jump into a care plan. And it's going to separate ourselves from every other chiropractor in our town that produces or tries to provide symptom-based care. Not just chiropractors, but any other healthcare practitioners, be it medical or some sort of medical type of profession. So the key principle is patients should never feel sold here. They should feel like they finally understood the true cause of their health problem, the underlying cause. That's the key. So it really comes down to mindset first. So we're going to talk about mindset first and where we need to get ourselves. So the first sale is to ourselves. And I had a coaching call the other day, and this is exactly what we talked about on the coaching call. So before patients believe in chiropractic, we must own it. So the question is, do we truly believe vertebral subluxation is serious and will cause early death? And that's something, if you can't own that, you can't look somebody in the eye and say, if you're subluxated, you are dying from the inside out. It will shorten your life. It will decrease the quality of life. It will decrease your performance. It will decrease your potential. Everything in there, if you don't own that, that's where we got to get started from. So are you really confident that you can provide subluxation correction? So have you set up a plan in your office, in your care, in the way you deliver chiropractic, the way you adjust people, and everything else, whether it's the rehab section, spinal correction, vibe plates, the mix, the fix, the set, all of that. If you're not confident in that, that's something you need to work on. Because the thing is, patients need to feel certain. And the next thing is that do you have a system that inspires patients to want chiropractic care for the rest of their life, not just for themselves, but for their entire family? So it's building that system. So if the answer is anything less than absolutely to those statements, patients will see hesitation. They will see a lack of certainty. So here we go. So we got to stop thinking like a pain doctor. And this really, I put this in here because of the coaching calls I've had lately. So most healthcare providers are asking, chiropractors included, how do we help the patient by relieving symptoms? In other words, you get out of school thinking, I want to help people. Well, the only mindset that you have getting out of school, especially certain schools, is that you want to help people get out of pain and get out of symptoms. And so you're starting to decide, okay, what's the diagnosis? In fact, again, this is part of a conversation the other day. What was the diagnosis? And here's the big thing. We have to stop diagnosing conditions. We are not treaters of conditions. And here's a study to back that up. This is from the Mayo Clinic in 2017. You can look it up. 235 patients were seen by two different medical doctors at separate times. The first diagnosis of that patient was written down, and then the patient would go blindly and see the second medical doctor, and 88% of the time, the second medical doctor came up with a different diagnosis than the first medical doctor. So there was only 12% of the time in those 235 patients that the second medical doctor came up with the same diagnosis, that there was an agreed upon diagnosis. So the point of that, the moral of that story is stop diagnosing conditions, because often you're wrong. And frankly, it doesn't matter anyway, because you're still going to adjust them. You're still going to correct the subluxation and remove the interference. So we need to forget about the condition, make sure it's number one, safe for them to get chiropractic care, that they don't need to be referred out for something. And the third thing is that get them under a state of care plan where you're correcting subluxation, no matter what the condition is. And I would even say, I would go back and say, even if you do think it's something they need to be referred out to, they still need chiropractic care. It doesn't matter. Everybody needs chiropractic care on some level. So corrective chiropractors ask, why is the body producing symptoms? And just remember that symptoms are only warning lights, they're adaptations, they're a compensation, and they're the body's attempt to survive. So they're the result of an underlying problem. So symptoms are not the primary problem. The objective is correction of spinal dysfunction, which is subluxation patterns, and restoration of normal nervous system function, not pain relief. So we got to own that first. If we're going to close people on care plans, we have to own that first. So your confidence comes from your conviction.
One thing I want to add is the thing you opened with is that conversion doesn't happen at the report. Like this opening piece is so huge. I coach so many people. They're like, yeah, conversion's not going well. I really got to work on my doctor's report or my day 3 or my ROF, whatever it is you call it or your procedure is. Then the reality is it's happening way before that. They've made the decision long before you see the result on that day. So this opening piece that Colin's going through, this is where most people need to get better.
So remember that patients borrow certainty from the doctor. So they're only certain if you, as the doctor, are certain. So if you sound uncertain, if you sound hesitant, patients become uncertain. And an uncertain patient will not sign on to a care plan. If you go out to buy a car or buy a house or buy something, especially if it's something that costs some money, a big ticket item, if you're uncertain about the purchase, you're not going to make the purchase. So you need to lead with your certain. The best quote unquote salespeople are very certain about what they're delivering. So if you apologize for recommending care, if you in your mind think that your care plan is too intense or too expensive or too long or too many visits, it's not going to work. Patients will always question the recommendation. So doctors don't sell. Doctors recommend what they honestly believe patients need based on their assessment for subluxation. So here we go. So the patient journey begins on day 1. So the care plan close begins way before you ever present it. And this is the biggest mistake that most chiropractors make, is waiting until day 2 or day 3 to really explain chiropractic and the chiropractic principle. So the care plan begins the moment the patient walks through the door. So here's the big objectives on day 1. This is not a day 1 call. We're not going to go through day 1, but here's some things to keep in mind is that there are really 3 things that need to happen on day 1. And that is, you need to build trust. So obviously connecting with the patient, listening, showing concern, asking questions, discovering their story. So we're not necessarily questioning about their symptoms. We're questioning about their health history, their lifestyle, their hot button, the stress, the injuries, and the adaptation over time. And the big question is to the patient, what would life look like if this problem were corrected for good? How would their life be different? Giving them that hope, painting that picture in their mind, they need to see that because that's an emotional connection. And people make decisions based on emotion. So you need to connect that. What would your life look like if we could correct this problem for good? Not just put a Band-Aid on it, but correct it for good. So help patients understand their current problem didn't happen overnight. We need to introduce the cause. And the cause in this case is going to be subluxation. The effect is the symptom, but the cause is subluxation. So remember, training on this day 1 script is very, very important. First of all, asking permission. Joe, do you mind if I go over a few things of what we're going to be looking for today? Get their permission. And they key up. They're intently listening. You talk about the intelligence in the body, the healing, the regulation, how it functions over the nervous system, the cause of the pain being subluxation, how when that affects the nervous system, it affects the organs. And if this is the problem that we find, if this gets left uncorrected, it will get worse. There's no maybe, it will get worse. Subluxation is a progressive condition. It is certain to get worse over time if it's left uncorrected. Own that fact. Make sure you communicate that fact. Really important. So remember that the symptoms are the effect, not the cause. The cause is the nervous system interference, lack of healing, progressive degeneration. Connect it to the organs. It's so important on day one to connect it to the organs. They came in with headaches, they came in with back pain, they came in with a shoulder issue, a knee problem, whatever. Connect it to the nervous system, connect it to the organs. And therefore, then you connect it to dis-ease or disease and early death. It is 100% that's the way it happens. And really start to own that fact and get good at communicating that. Your examination on day one, and this is preemptive of the closing. If you have a good examination on day one, you're going to facilitate your closing on day three. Perform the thorough examination consisting of objective findings for nerve interference. So examine your exam. If you're doing anything in your exam that amplifies symptoms, that in the patient's mind gets them thinking that you're looking for symptoms. It could be an orthopedic test, a straight leg raise, a Kemp's test, whatever. If you're doing anything where there's not an objective measurement and there's a subjective finding, like when you do a straight leg raise, where does it start to hurt? Oh, it starts to hurt there. You've just blown it. You've completely blown it. So explain every test you do and relate it to subluxation. Tell patients, I'm looking for why your body isn't functioning normally and stopping you from healing the way that you should be healing, the way that God created your body to heal. Start sharing that with them on day one. And then you finish day one with certainty and concern. You're not diagnosing, you're not labeling them with a condition. You're creating anticipation and saying, I suspect we have found subluxations. I think it might be worse than what we thought. I want to take a look at your scans. I want to take a look at your x rays and really determine if and how I can go ahead and correct this and if I can help you. At this point, they're applying for your care. You're not applying for them to be a patient, they're applying for your care. So you don't know if you can help them yet. This is worse than what I thought. You know, these are things that really help solidify in the patient's mind. If you found subluxations, they might have thought it's a simple muscle strain. You found subluxations, that's a neurological condition. This is a nerve problem coming from subluxation, and it will get worse if we don't take care of it. So you're starting to shift the patient's mindset. And then you do your day one phone call to solidify all that.
Humans by nature are minimizers. So if you are not getting at least 50% of your day ones onto signed care plans, that's not people who make it to the report. It's the people who walk in for a new patient exam at least 50% onto a signed care plan. You need to work on this part. If you are there, you're 60, 70, you want to get better, I'd also recommend, this is a big thing I've worked on with my associates, because patients and people in general are minimizers. So as you're going through, even on their, if their symptom is what brought them in the door, let's talk about, like, ask them the question. So when it was at its worst, describe that to me. You're taking them to when it was at its worst. They're thinking about, hey, I've had this recurrent low back pain. And it's like this right now, but when it was at its worst, you know what? I was in the hospital for 2 days, right? So you're building really what's going on. You're then talking about all the secondary stuff that got going on. Well, in addition to that, I also get headaches. I have these digestive problems. I got menstrual disorders. I got thyroid issues. You're building all this stuff. So they're like, at the end of it, they should be like, yeah, so I have back pain, but I have all this other stuff going on. I need to pay attention to this. Like, you want to make sure you're bringing it all out. It's not just about the one little symptom, it's the person as a whole. And again, it's bringing it to the light so you understand them. They can also really start to take a good look, be like, hey, there's something here I got to manage because there's way more going on than I thought.
And
I'd also want to jump in there, like subluxation, vertebral subluxation is a diagnosis. That is a diagnosis that we look for. That's what we treat. That's what chiropractic is a specialty of. That's what we're founded on. So the question I think, Diana, you want to start to think about, am I trying to diagnose as a pain technician of some sort, or am I diagnosing as a principal chiropractor looking for cause, looking to maximize someone's health? So that's a fundamental shift that has to happen in your brain. Because I had a great conversation with a lady just the other day, and she's like, so if we fix this, like this is the cause of my low back pain. And we talked about, and I'm like, to be honest, I'm not looking for the cause of your low back pain. There's something that's stopping your body from healing. Would you agree, and I'm talking to the patient, that for you to have, and she had back pain, leg issues, headaches, digestive problems, she was dealing with all these other inflammatory issues. And I'm like, would you agree that something's not working right? Like your body isn't healing itself? And she goes, yes. I'm like, that's what we're looking for. And if we find it and fix it, there's a chance that all of these things, your body can heal them. That's what we're doing.
that's a Brian. I mean, you have a very good way of articulating that, and So here's my thing, and when I say that, Diane, I don't mean to be blunt, but I think that's the biggest problem in our profession, in the fact that we go to school and we graduate with this mindset that we are some sort of parallel with a medical doctor. And the thing is, we have to understand that we don't treat conditions. We don't treat symptoms. Our ability to treat is extremely limited. That's why we don't treat. That's why I hate using the word treatment. What we do is we assess for the root cause, and that is subluxation. So that's Brian explained that very, very well. And I hope that makes sense. So if you can really have good communication with the patient, and not to minimize their conditions or minimize what their quote unquote diagnosis would be, but help them understand that getting to the root cause of why that diagnosis is there is the best thing that you can do and the most important thing for the life and health of that patient. Let's move on from day one to day two really quickly. And again, this is the next part of the closing. So if on day two, you're not going over every single new patient in huddle with your team and explaining to your team, okay, so and so is coming in for a day two today. This is what we found on their day one. Maybe you pop their x-ray or even one of their views, their lateral cervical, up on the screen to show your team how severe it is, and discuss what the next step is for that person, so the team is all on the same page. So not just the doctor can show concern, but the whole team can show concern on day two. That's a huge part of the closing. If that person can walk in at the front desk and your team is basically waiting for them, that front desk person is waiting for them and can immediately greet them and show concern and say, hey, Justine, I'm so glad that you're here today. We were talking about what Dr. Collin found in your exam yesterday. He's very concerned and wants to talk to you about the next steps as far as your healing and correction go. It immediately changes the state of that patient, immediately. So these are some of the things that I really want to focus on day two. And we did this with their team, is that in almost every single case as a new patient, if we find subluxations in their spine, they're in a phase one or phase two, it's worse than what they thought. They thought they were coming in with some sort of symptom, some sort of pain, some sort of muscle pull. It's worse than what they thought. So I'm going to let them know this is a problem that's worse than what you thought. It's affecting your organs. It's not just a pain in your back. It's affecting your nervous system. It's affecting your organs. That's causing dysfunction. That's causing dis-ease, your body's inability to heal and adapt. On a scale of 1 to 10, I let them know this. This is a good quantification. On a scale of 1 to 10, you're a 9, you're an 8, whatever that is. I want them to classify themselves as being on a scale of 1 to 10 so they can help to understand how severe this is, if it is. I'm telling them the absolute truth, but that truth is ingrained in my soul. I own that. I know that. I know if I see subluxation, it's a serious problem. Okay. So then I've set special time aside to go over your exam findings in detail. I'm doing this as a courtesy for them. This is not a class they have to come to. This is a courtesy for them that I've set special time aside. And I don't care if it's within my schedule or outside of my schedule. It doesn't matter. I'm letting them know I've set special time aside to go over their exam findings in detail. And most people ask at this point if they can bring a spouse or support person. So do you have a spouse or support person you'd like to bring with you to see your exam findings, to see your scans, to see your x-rays, discuss what the next steps are? I want to give them hope, right? And on day two, I'm giving them hope. So this is absolutely something I can help you with, but I want to reassure you, it's not a quick fix. It will take some time. So again, I'm pre-framing what's going to happen when I present the care plan. So then we get to the doctor's report. Now, some of you do your doctor's report on day two or your report of findings on day two. Some of you do it on day three. However you do it, it's the same situation. It's the same flow. Okay. It's not a sales presentation. And if there's any part of you that thinks that you're there to sell this person into a care plan, you have to get that out of your mind. You are there to save their life. You're there to change their paradigm. You're there to change your thinking. So change their thinking. So we have to really get that ingrained in our soul. You're going in there to save their life. It's a clinical consultation out of courtesy and concern. So you're never thinking, I'm trying to close this person. You're changing their life. I'm helping this patient understand the principle of chiropractic, and this will change the way they think from now for the rest of their life. They're going to think differently about everything. They're going to start questioning every medical decision they've made in the past once they start understanding this. You begin with some education. Again, whether it's your ROF or whether it's your doctor's report, whether you do a group, if you're doing a video, however it is, it's the same system. You talk about normal function, health, and healing. You talk about how the nervous system is the master controller. You talk about spinal health and decay. Show them the decay in the spine. Show them those x-rays where you show them phase one, phase two. Show them the pictures of the MRIs where the spinal cord gets crushed as the spine subluxates and degenerates. And then you can relate it to the body communicating from brain to tissue cell, healing, including ever reaching their God-given potential. Nobody will ever reach their God-given potential if they are subluxated. It can't happen. It will not happen. Okay. So then you compare normal to abnormal, degeneration, disease, and early death. And again, I mean, if it's not clear, I own that. Like that's something, and that's one of the reasons why we had such a great practice. I just own that. And I don't care if people call me a quack. I don't care what people think of me. I own that concept. I know, a lot of us practice in fear from our boards. I know Alberta's going through it, CCO, all these different things. So I would suggest you get to the point where you practice with confidence. If you can care for people with integrity and you're caring for them the way that you would care for your own family members with compassion, you're never going to have trouble. You may get the odd complaint, but you're never, ever going to have trouble. Use objective findings. Patients trust what they see. So remember those objective findings. That's what you need to show them. So the x-rays, the measurements, posture analysis, scans, neurological findings. Never rely on an opinion. And remember those orthopedic tests are completely subjective and they're only an opinion. That's all they are. And if your board tells you you have to do orthopedic tests, if that's what they're telling, then write down an orthopedic test on your exam form just so you're compliant. And I mean, like, legally, if you need to do it, write it down. It's in your exam findings so you never get in trouble. I mean, just make it happen. Explain the clinical significance before you present the care plan. These are the findings. This is the nerve interference. Here's the reduced function. This is how your body's adapting. This is how it relates to your symptoms. And if this continues to get worse and you do not correct it, you have degeneration, dysfunction, disease, and early death. So emphasize that those symptoms are only one expression of a deeper functional problem. So then you present the care plan. Once you've gone through that and you feel confident that you've delivered it with certainty, that's when you can present the care plan and explain this is why correction takes time. Use your examples of your braces and orthodontics. I mean, nobody goes to the orthodontist and think that they're going to be done in one visit. People just don't think that way. Inherently, it doesn't happen that way. We need to compare ourselves to that process. It's physical remodeling. If you go to somebody for weight loss or you go to somebody for strength training, it doesn't happen in one visit. Even rehabilitation, you go to the physiotherapist for some sort of rehab, you don't go for one visit. It's a process over time. So correction and healing is a process. It's not an event. That's why we don't offer pay as you go. And I would, in fact, come straight out and tell the person before you present the care plan or as you're presenting the care plan, so you don't give them the option. That's why we don't offer pay as you go. It's a process. We have a 36 visit care plan, a 60 visit care plan, a 120 visit care plan, whatever that is. That's our care plan. We don't offer pay as you go. It's a package. Deliver your recommendations with confidence. So instead, based on your examination findings, this is the care that you need specifically. This is the care that you need. Patients expect recommendations. They want to be led. So understand that you're not there trying to sell them something. You're there telling them what they need. And they want that. They want that certainty. That's what is the professional way to do that. And holding firm without being pushy. So you're not selling, you're educating, teaching, recommending, and allowing the patient to choose. That's the biggest thing. So watch your language. And this is why we train on this stuff when you're presenting a care plan. So get rid of the words, maybe, I think, if you'd like to, I need you to. You start saying, my recommendation is, based on your examination findings, can I talk to you like you were my brother? Can I talk to you like you were my sister? It shows that connection. This is exactly what I would recommend for a member of my own family. And don't back down on it. Never negotiate. Somebody says, listen, my schedule doesn't allow me to come in 3 times a week. My finances don't allow me to come in 3 times a week. Whatever that is, there's some logistic. Never compromise. You've set your recommendations and come straight out and say, I'm unwilling to compromise the care. I want you to get the best results for your care. I'm unwilling to compromise the schedule. If you need to compromise the fee or the price, then that's totally up to you. And there may be certain situations where you need to do that, but never compromise what you genuinely believe is clinically appropriate solely to obtain acceptance. So if that person says, "Oh, I can come once a week," and you accept them, you've just lost your integrity. And here's the big thing. And I would say to you guys, be willing to not accept a patient. If you can get yourself to the point where you're actually willing to not accept a patient, it shows tremendous integrity to the patient. It shows tremendous integrity to your team. And watch what happens to your office. All of a sudden, you start attracting people that want the care that you're wanting to deliver, instead of attracting people who are coming in as tire kickers or coming in as compromisers. And you take your practice away from the Burger King chiropractic, where you're um, doing, allowing patients to make their own decisions, have it your way, to the practice that you want to have. It really, really makes a big difference.
The one thing I'd want to say on if it shows up anywhere on day one or day two that the patient has a financial concern, make sure you address it. You don't roll over it. So if someone's asking about insurance or money or fees or those type of things, make sure you address it there. And if they do have any financial concern, they need to know they're always going to get your best recommendation. But if they think they might have a challenge with finances, then we always tell them like, hey, just we will work with you. Your job is to review your budget before you come to the report so you know what your budget is. And we will work with you to find something that will work if you can't do the ideal recommendation for care. You want to, the key to this is you're having them show up to the report with the materials and the decisions made to actually make a decision or sign a care plan. If they come with uncertainties, they don't know what their insurance covers, they don't know what the budget is, they don't know what they can afford, there's no way they can make a decision at that day. So you want to make sure you've set them up, you prepared them so they actually can make the decision that day.
And let me just address a couple things here. Is that when I go through this stuff, um, I'm going to say, and I'm going to delete this from our video here. But sometimes you might think the way that I'm going through it, I sound like a bit of, and I do. But I'm going to tell you, I do it because I am so confident in what we deliver chiropractically. And I think part of our problem as chiropractors is we lack that certainty. We lack that confidence. And we're so concerned about the patient being a patient in our office, and that adds to our bottom line for our income, that we compromise our decisions so much. But I'm going to tell you, and I'm going to submit to you that as soon as you can get yourself to the point where you don't care about that, you don't care about that patient being a patient and being an extra stream of income for you, and you can be so grounded in your true ownership of chiropractic and the correction of subluxation, that's when things change for you. I guarantee that's when things change for you. That's when people start becoming lifetime patients, when they start bringing their kids. And sure, are there going to be some people that don't get care from you? Absolutely. There are going to be some people who say, "This is not what I want. I want to go somewhere else." And compassionately and lovingly, you say, "Okay, I'm totally understandable. I can refer you to somebody who will provide pay-as-you-go care, or adjust you on the first visit, or give you some sort of modality that you don't want if you don't want to get adjusted." All these different objections. So, but I would say for you guys, be confident with what you're delivering and your ownership of subluxation. So here's a few common objections that happen through this whole process. By the time you present the care plan, well, you know what? I feel fine. I just wanted to come for pain relief. I think I'll just wait for a while. I need to go home and think about it. I need to talk to my spouse. This is the time, if you get those objections, you can't defend what you've already said. It doesn't work. As soon as you start defending, you've lost. This is the time to recognize that and ask questions. And so, some very good questions are you willing to continue covering this problem up with a band aid? And then just be quiet. Ask pointed questions that help the person really just feel it, feel that emotional. When I say that, and I can look them in the eye and say that, there's an emotional moment there. It's almost like an awkward emotional moment. If you leave this, do you think this problem is going to get better or worse? If you ignore this, do you think you're going to get healthier or sicker over time? If they say, "Oh no, I need to go home and talk to my spouse," if for some reason the spouse wasn't there, if your spouse knew your body was degenerating and dying from the inside out, do you think they would want you to take care of yourself? Just some very pointed questions like that are really, and the person may just say, "No, I'm out of here. I don't know." But it's going to help you maintain your integrity. And that person might go home and think about it and then decide, "Okay, they were right. I need to to come back. I need to start. Now I know what I'm getting. I need to come and start. So ask the questions. This is not the time to start re-explaining yourself, right? If you get any objections in the care plan. Confidence is compassion. So being direct is not being aggressive. Patients deserve your honesty and your certainty. So if you truly believe correction's in their best interest, if you truly believe they're subluxated and they need corrective chiropractic care, communicate that clearly. Don't compromise. Don't lose your integrity. The last few things here are beyond day 3. So now you've signed somebody onto a care plan. This is how you keep them as a lifetime patient. So you reinforce their decision, because there's still going to be people that sign up and go home and think about it, and they get buyer's remorse, or they think they made the wrong decision. So on day 4 and beyond, you're getting them engaged in your mission. So they absolutely should be doing some level of home care. That keeps them engaged outside the office. You should be asking for referrals. This is a mission. It's not just about them. It's about changing the community. Get their family checked. Families that are under care stay for the long term. Get a patient to a dinner. If you're doing dinners, get that patient to a dinner in the first month or first couple of months of their care. Schedule an advanced talk. So if you do a regular nutrition talk or you do a regular talk in your office, get them to that advanced talk. Get them engaged in everything that you do, and pre-schedule. Make sure the team knows that once that person is signed on for the care plan, they're pre-scheduled. Every single visit is pre-scheduled, at least to the first re-exam, at least for the first 30 days or the first 12 visits, whichever comes first. So build lifetime thinkers. Remember, you're changing people's mindset. You're changing their thinking. So the objective isn't simply finishing the care plan. The objective is helping patients understand how spinal health, how nervous system function influences lifelong function, and why ongoing chiropractic care should remain a top priority. Bottom line, if you can take out of this call that you provide something unique in the healthcare world, something different than anybody else does. There's no other health practitioner, be it medical doctors, osteopaths, physios, massage therapists, naturopaths, whomever, it doesn't matter. Nobody provides what you can provide. You provide something unique and different, so own that. And it's better than anything else because you're getting to root cause. You put nothing into the body, you take nothing out of the body. You only allow the body, that God-given intelligence, to flourish and function the way it's supposed to. That is the biggest thing that you can provide to people. And if you can help them understand that, you've won. So the final challenge is here. So do I truly believe in what I do? Do I own subluxation? Do I know that subluxation is absolutely the worst thing that could happen to somebody in their health journey? Am I communicating with clarity and confidence? So do I own my scripts? Have I trained on them? Do I really understand them? Have I helped my patient understand the difference between symptom relief and improving spinal and nervous system function? So have I gone over my systems? Does everybody in my team know their role in those systems? The day 1, the day 2, the day 3, every single little detail, every single little piece of those. If I haven't trained on that to the point where we can't get it wrong. We train so much, not till we get it right, we train so much that we just can't get it wrong. And am I recommending care based on my best clinical judgment without compromise? I'm not compromising my recommendations. So the last little quote here is, people rarely commit to what they don't understand. So if you're not getting closings on care plans, if you're compromising, you're getting pay-as-you-goes, or you're accepting pay-as-you-goes because the patient didn't want to go on a care plan, it's only because they didn't fully understand. So your responsibility is not to persuade or try to sell them. It's to educate with clarity, conviction, and integrity so patients can make an informed decision about their own health journey.